Kevin Duala at breakfast. BBC Radio Merseyside.
So I've been talking about a lot about this morning on the show. 5 years ago today, Atletico Madrid played Liverpool at Anfield in the second leg of their Champions League encounter. And as we've been finding out, it was COVID-19, it was spreading rapidly. And on the 23rd of March, the then Prime Minister Boris Johnson announced a national lockdown. It changed everything, didn't it? We were all glued to our tellies watching it. The way we lived, the way we worked, the way we communicated, everything stopped, everything changed. Well, an investigation found Liverpool's game was one of two major sporting events, along with the Cheltenham Festival, that caused increased suffering and death. Well, Professor Tom Solomon is director of the Pandemic Institute in Liverpool, and he told Radio Merseyside's Angela Heslop that with hindsight, the match should never have gone ahead.
I think most people agreed that it shouldn't have happened. It was a difficult time. The pandemic was spreading. It was in Europe. It was in the UK. We had not yet introduced our measures, but actually by then some events had been stopped. The rugby had been stopped. For some reason, the football went ahead and the Cheltenham Festival went ahead. I think that did lead to cases earlier that would not have happened at that time. So it was not a good decision. Having 3,000 people coming from Spain at that time meant that there was a larger introduction than was needed at that time. Although, of course, ultimately, the numbers were enormous. And the numbers of everybody has been infected more or less, except for those who managed to get the vaccine before they were infected. It's questionable about how big a difference it would have made in the overall national picture. But for the individuals affected, it was clearly very important.
Now, we have got the Pandemic Institute in Liverpool, you're director of it. Why was it set up?
Well, we've done research on emerging infections and pandemic threats in Liverpool for decades. And in fact, since 2014, I've been the director of the UK's Emerging Infections Research Unit, which is funded by the government. And we still manage that unit, run it from Liverpool. But what was clear during the pandemic is that we brought together more than just that. We brought the whole city together, the main three universities, which is Liverpool University, John Moores University, and the Liverpool School of Tropical Medicine, plus the hospital came together, plus, of course, the response of the civic authorities, the Liverpool City Council and the Regional Combined Authority. So during the pandemic, we worked really well together, and the Pandemic Institute keeps those organisations together. It's an umbrella organisation to help protect us from emerging infections and future pandemic threats.
Now, of course, obviously you mentioned how much research is done through the Institute and people working collaboratively. What then do you think are the main lessons that we've learned from emerging from COVID-19 to help prepare us for any future pandemics?
So one of the things that we did during the pandemic in terms of bringing these organisations together was the mass testing programme. You will remember that at the start of the pandemic, only people who had symptoms of the disease were tested. But we knew that there were people around who had the virus, but didn't know they had it, and they obviously could pass it on to others. So in Liverpool, we did this amazing research programme led by Matt Ashton from the City Council and Ian Buchan from the university, plus many, many others, to say what impact would mass testing have. And you may remember the army came to help out because we needed more boots on the ground. And you remember, I think it was something like half the city population came along and said, yeah, we'll get tested even though we have no symptoms. And through that, we found people who had the infection. And of course, they then isolated to protect others. And it was a brilliant example of the Liverpool city spirit, unmatched really with anything anywhere in the world. And what it showed us was that if you do that kind of program, you can get the cases down. And I think the number of cases dropped by something like a third. I don't remember the exact numbers. The hospital cases by about 40 to 50%. And that showed us this is how we're going to get this disease under control. So it was brilliant work. And it very quickly became national and international policy. So it's that kind of work of the different organisations working together that's what the Pandemic Institute is all about. And then in terms of preparing for these future threats, we're doing quite a lot of work on developing diagnostic tests and vaccines and drugs for emerging infections. So you've seen some of this with some of the more recent problems like Mpox and avian flu that we've worked on through the Pandemic Institute. And it's all about really trying to stop some of these emerging infections from becoming pandemic. And that's why with things like Mpox, we've done work trying to understand how the virus is transmitted, why people get infected. And Mpox, therefore, it's been a problem, but it's not been anything like the size or scale of some of the other big emerging infection problems we've had in the past. Beyond developing diagnostic tests and treatments and vaccines, the work of the Pandemic Institute is also about the policy work for things like how to stop the spread of these infections. But additionally, one of our big remits is to try and bring commercial interests, companies to the city to try and increase employment and the economic growth of the city. And Pat McFadden was with us in Liverpool just a few weeks ago. You may remember when they launched the government response to Module 1 of the public inquiry. And he came to Liverpool because he recognised how important Liverpool is in controlling infections like this, but also that this is a bit of a powerhouse in the country for commercial partners and research work on tackling emerging infections. So I think there's a real national recognition that Liverpool is the place to be for this kind of work.
And can we contribute to this research in the sense that perhaps we should still be careful about healthcare, making sure we prevent infections and try not to spread germs?
Yeah, I think public attitudes have changed since the pandemic. So you'll remember one of the things we all learned to do was to work from home. And then even as we came out of the restrictions, people would test themselves. And if they were positive, they would stay at home so they don't infect others. And I think we see more of those behaviors, even with other respiratory viruses like influenza and a virus called RSV. I think people now are much more inclined, if they have a cough or a cold, people are more inclined to then stay at home and keep away from others, keep away from vulnerable people like the elderly or people with other illnesses to reduce the risk of these infections passing on to others.
Professor Tom Solomon, Director of the Pandemic Institute in Liverpool.